Hi all. Today I am going to discuss a small topic that is hiatus hernia or a hiatal hernia. First we can move on to what is hiatal hernia or the definition of hiatal hernia. In a hiatal or a hiatus hernia, the opening in the diaphragm through which the esophagus passes become enlarged and part of the upper stomach tend to move up into the lower portion of the thorax. And some of the causes of developing these hiatal hernia are there. Anything that greatly increase the intra-abdominal pressure or a lifestyle that weakness the connective tissue of the body can potentially cause the hiatal hernia. The thing that increase the abdominal pressure, that is in the case of obesity, pregnancy, trauma, then heavy lifting, then constipation and excessive coughing. In these cases may chance for getting increase the abdominal pressure. And also in some cases the weakened connective tissue, that is mainly smoking and alcoholism and poor diet and sedentary lifestyle and chronic stress. In this case may chance for weakness of the connective tissue. And some of the risk factors are there, mainly age, and women are more prone to get than men. And also increased in intra-abdominal pressure and fiber depleted diet and chronic esophagitis. In this case, these are the risk factors or a risk for paraesophageal hiatal hernia. So, the hiatal hernia are divided into mainly two types. First is the sliding hiatal hernia and second is rolling hiatal hernia. The first one, sliding. The sliding or a type 1 hiatal hernia, this occurs when the upper stomach and the gastroesophageal junction are displaced upward and slide in and out of the thorax. This occurs around 90% of cases. And the second type, that is paraesophageal hernia or a rolling type of hernia. And according to the extension of herniation, these are classified type 2, type 3 or type 4. And it occurs when all or part of the stomach pushes through the diaphragm beside the esophagus. And according to this type, the clinical manifestation or clinical features are some different. First, sliding hernia. So mainly in this case, heartburn, then regurgitation and dysphagia, and at least the half of cases are asymptomatic and often here implicated in reflux. And in the second type, that is paraesophageal or a rolling type of hernia, here sense of fullness or a chest pain after eating or maybe asymptomatic the features, and the reflux does not usually occur in this case. And some other symptoms also present, the mainly frequent burping and difficulty in swallowing and throat soreness and belching, and also may present nausea. So, and in the diagnostic method, mainly can using for X-ray studies and barium swallowing study and upper endoscopic study. And in the upper endoscopy can use gastroscope is used to evaluate the esophagus and stomach, and also can use fluoroscopic study and CT scan. And in the management part, mainly in the medical, surgical and also the nursing management are there. In the medical management, we can mainly use for antacids and H2 receptor antagonist, can use cimetidine and proton pump inhibitors, that is omeprazole or a gastric acid pump inhibitors. Then Prokinetic agent can use metoclopramide or Reglan can use. And other management, that is frequent and small feeding, will advise this easy to pass through the esophagus are given, and advise patient not to recline for 1 hour after eating, and advise elevate the head end of bed. This prevent or blocks the hernia from sliding upward, and surgery is indicated in around 15% of cases that the patient having the paraesophageal hernia cases, it is an emergency surgery will need. And in the surgical management in the Nissen fundoplication, here in this procedure involve using stitches to wrap the upper part of the stomach called the fundus around the bottom portion of the esophagus in order to hold the stomach in place below the diaphragmatic hiatus. In this picture, you can see the normal stomach, and after surgery what is happening. In the fundus wrapped around distal esophagus and secured with a sutures. And this also same. And another management, that is another surgical management, that is hiatus repair surgery. Here in this surgery uses a sutures and a prosthetic mesh can using for a tighten the hole or a tighten and a decrease in the size of the enlarged hiatus. Then here mesh can use, and the opening will wrap, which is the opening in the diaphragm that the esophagus travel through on its way to the stomach, and it prevents stomach from bulging upward through the hiatus and is used for early stage of hiatal hernia. In this picture, you can see the mesh can using for the tighten the hole. Then another surgical management, that is Nissen gastroplastic surgery. In this surgery, it is used to lengthen the esophagus in patient with more complex form of hiatal hernia due to esophageal shortening cases. In this procedure, the surgeon will use tissue from the upper part of the stomach, and this will help to extend the esophagus. In this picture, you can see the part of the esophagus they are taking and to extend the size of the esophagus. These are the surgical management. Another, that is the nursing diagnosis part. According to the patient condition or a patient symptom, we can formulate the nursing diagnosis. Mainly the patient symptoms are a chest pain. So according to the prioritized way, we can select the acute pain, that is the first nursing diagnosis. Acute pain related to difficulty swallowing, ingestion of abrasive agent or a tumor or a reflexes. The next is the imbalanced nutrition, because the patient have a dysphagia or aspiration, so like that patient can't take food properly. So the second nursing diagnosis, that is imbalanced nutrition, less than body requirement related to difficulty swallowing. Then risk for aspiration and deficient knowledge, etc. will formulate. Then according to the nursing diagnosis, we can formulate the interventions. The first one is encouraging adequate nutritional intake. Encourage patient to eat slowly and chew all food thoroughly, and recommend small and frequent feeding, and avoid irritant foods, and advise for taking non-irritating food, and sometimes drinking liquid with food help to passage, and prepare food in an appealing manner, that is helping for stimulate the appetite, and also advise for avoid to take irritants like tobacco, alcohol and caffeine producing foods, coffee, etc. Then obtain a baseline weight and record daily weight and assess for nutrient intake. Then decreasing risk of aspiration. What are the interventions? If patient has difficult swallowing or handling secretions, keep him or her in at least semi-fowler's position can advise. That is helping to prevent aspiration. And also instruct the patient in the use of oral suction. That is helping to risk for or decreasing the risk of aspiration. Then last one is relieving pain. So what are the interventions will provide? Teach the patient to eat small meals frequently. Around 6 to 8 meals per day can advise. And advise patient to avoid any activities immediately after meal. This can increase chance for getting pain. So, advise patient to avoid any activities that increase pain and to remain upright for 1 to 4 hours after each meal. That is helping to prevent reflux. Then elevate the head of bed on 4 to 8 in blocks that discourage eating before bed. Then advise patient not to use over-the-counter antacids, and this because of possible rebound acidity, and instruct in use of prescribed antacids or histamine antagonist. So these are the management part. I hope you understood this small condition. Thank you.